Welcome to OEC Health Talks. I'm Joe Naglowski, OEC President and CEO, and we are excited for you to join us for this educational video series that dives deeper into specific health topics that we know are important to you and the OEC community. Today's OEC Health Talk tackles another important topic, telemedicine, medical obesity care at your fingertips, featuring co-founder and Executive Vice President of Intellihealth, Dr. Kathrine H. Saunders. Telemedicine became a popular tool during COVID-19 as it allows providers to practice medicine with patients who are in a different location through electronic communication. In the OEC's upcoming Health Talk, Dr. Saunders will teach you about telemedicine and how it has improved access to medical obesity care. And with that, take it away, Dr. Saunders.
Hi, I'm Dr. Kathrine Saunders. I'm an obesity medicine physician at Intellihealth, and I'm thrilled to be here with you tonight for this health talk sponsored by the OAC. I'll be talking about telemedicine, medical obesity care at your fingertips. So over the next 20 minutes, I'll be talking about how telemedicine can address barriers to obesity treatment, how telemedicine can facilitate care per obesity medicine guidelines. We'll talk about the benefits, the limitations, and unanswered questions surrounding telemedicine for obesity. We'll talk about tips on how to get the most out of telemedicine. And then finally, review how telemedicine aligns with initiatives to reduce health disparities. So just to take a step back so we're all on the same page, there's so many different definitions of telehealth versus telemedicine. I will be talking about mostly telemedicine during this talk, but touch on telehealth a bit. The definition of telehealth is really use of electronic information and telecommunication technologies to support and promote long-distance clinical healthcare. So general clinical healthcare, this is a much broader definition of patient and professional health-related education, public health, and health administration. So a much broader definition compared to telemedicine, which is much more specifically the practice of medicine using electronic communication, information technology, or other means between a provider in one location and a patient in another location with or without an intervening healthcare provider. So welcome telemedicine because of COVID. So why are we in this situation where telehealth or telemedicine is so widespread these days? In March of 2020, everything changed in healthcare dramatically overnight. At our comprehensive weight control center at Weill Cornell Medicine, literally overnight, we went from 100% in-person care to 100% virtual care. And what was very interesting when we looked back at our data of no-show rates was that the no-show rate decreased significantly from 15.8%, which was associated with in-person visits before March of 2020, down to 11.5% with telemedicine after March of 2020. So what this tells us is that, improved attendance at health visits is associated with improved engagement and potentially improved outcomes. So a very exciting potential upside of this switch from in-person care to incorporating telemedicine. So taking a look at what problem we're trying to solve with telemedicine, everybody who's watching this, I'm sure, is well aware of the most recent obesity rates. Over 40% of the population now in this country has obesity. And when you take a look at the number of specialty-trained healthcare providers like me who are trained and able to provide a very high level of comprehensive and empathetic obesity care, according to the most recent numbers from the American Board of Obesity Medicine, actually as of this week, there are almost 7,000 board-certified physicians in this country, which sounds like a great number, and it's about 1,000 more than last year, but the supply-demand mismatch between the number of people who could benefit from comprehensive obesity treatment and the very few of us who are specialty trained to provide a high level of care is tremendous. When you take a look at the number of people with obesity who are being treated according to medical guidelines, it's only 2%. That is such a low number considering the numbers for other diseases like diabetes. That number is 86%. So 86% of people with diabetes are being treated according to guidelines, whereas with obesity, that number is 2%. So massive, massive, massive supply-demand mismatch. So how can telemedicine be a solution? Potential benefits include expanded access. So for people who didn't have as much access to in-person care, maybe they don't live close to an obesity medicine practice or other limitations, now it's much easier to be able to do everything virtually. Focus on safety. We are still in a situation in our country where COVID is around. People are concerned about risk of other potential viruses. So to be able to stay home and be in the safety of your own home and not worry about any exposure with clinical care is a tremendous benefit. Improving adherence and engagement, as we saw from the no-show rate data. Reducing cost associated with traveling to visits. And especially barriers related to mobility and transportation. Decreasing stress about weight stigma. Many of my patients tell me that when they used to come in person, some of them were concerned about, the bias, stigma, and discrimination with in-person visits. So now to not have to worry about that is definitely an added benefit. Matching or increasing effectiveness of care is something that we're continuing to look at data on. And then facilitating group visits is another exciting capability. We can now much more easily get several people together for different types of group visits or different providers in the same space much more easily than in person. But what are the limitations? Technological requirements can be quite onerous for some people. Less reliable vital signs. So many of my patients used to come in for weight checks and used to really depend on what their weight was on our scale. We have ways to get around this now. We can send scales to our patients, but it's different. Inability to perform a physical exam. So being unable to really be with the patient and, examine them in the same way can be tricky in some cases. Limited training for injectables. A portion of the medications that we use are injectable, and it's a little bit harder to learn how to use these medications if you don't have an in-person training session. Less access to lab testing. Used to be very convenient to have patients in the office and have them go straight to the lab. Need for HIPAA-compliant software. So our company, Intellihealth, has gone through different protocols to make sure that our software is HIPAA compliant, high trust compliant, but this can be quite onerous, and so it's a little tricky. And then finally, security concerns. Some patients don't want their data out there. They don't want to be doing anything virtually like this because of safety concerns. So let's take a look at the obesity medicine guidelines. When you look at a variety of different guidelines, whether it's the American Heart Association, American College of Cardiology, the Obesity Society guidelines, if you look at the Endocrine Society guidelines about how to deliver the highest quality of obesity care, or even the Canadian guidelines, what we see in common is that each of these guidelines recommends a comprehensive evaluation. Since obesity is such a complex disease, since there's so many factors leading to weight gain, so many barriers preventing weight loss, we can't provide a high level of care without doing a comprehensive evaluation, including medical history, blood work, and a physical exam. So while medical history is so easy to do virtually, unfortunately, we can't do blood work in person or a physical exam in person, but we have workarounds that I will discuss. And then in terms of comprehensive treatment, what all these guidelines have in common is to really optimize lifestyle interventions. So dietary counseling, physical activity counseling, behavioral counseling, For patients where it's appropriate, using anti-obesity medications, these can all be done, these components of the comprehensive treatment can be done virtually. The one thing is that for patients who are good candidates for devices, procedures, surgeries, obviously this cannot be done in a virtual setting. So what are the workarounds? In terms of the comprehensive evaluation, we have our patients go to local labs or see their primary care doctor to have their labs done. We can also arrange for in-home blood draws. For the physical exam, it's really amazing all of the technology that has advanced over the last few years. So we can do a remote EKG, a remote cardiology exam. There's so many different ways of sort of simulating a physical exam remotely. And this technology is just getting better and better. And then finally, while we can't, put in a device or do a procedure or do bariatric surgery virtually, so much of the pre-op care and the post-operative care can be done virtually to just make it, more accessible and easier for patients. So my area of expertise is in anti-obesity medications, and so I wanted to put in one slide just focusing on what I can and can't do and how I have to practice a little bit differently practicing virtually these days. So for the 6 medications that are FDA approved for weight, I'm not going to talk about the off-label medications during this talk, but just focusing on the FDA approved meds for obesity. Phentermine, because it's a controlled substance, because it's a stimulating medication that requires monitoring of blood pressure and heart rate and doing a cardiac evaluation. This makes it a little bit hard to prescribe virtually. There's some limitations and regulations around prescribing controlled substances as well in different states. So potential solutions for providers or patients who need to be on phentermine, a care model where there's some in-person visits and some virtual visits may make sense in this context. Coordinating with a primary care doctor to do an EKG, to do a cardiac evaluation, to do blood pressure, takes care coordination, but can be done. And then finally, remote patient monitoring. So when a patient is started on a medication where we need to monitor heart rate or blood pressure, we can send a blood pressure cuff, which can check these vitals and have that data transmitted electronically, or it can be input into a system in order to really get the data and the vitals that we need. For orlistat, I'm not going to get into orlistat because it's not used as much, but I don't see any challenges of prescribing orlistat virtually. Phentermine topiramate, so the combination, the Qsymia, same issues with phentermine, with state regulations, heart exam, monitoring blood pressure and heart rate, with the addition of pregnancy test. So topiramate is a medication that we call teratogenic. It can cause birth defects if taken during the first trimester of pregnancy. But a pregnancy test doesn't need to be done in person. This can absolutely be a home or a laboratory pregnancy test. Naltrexone, bupropion, or Contrave. Another medication that could increase blood pressure or heart rate, we can certainly do that virtually through remote patient monitoring or other mechanisms. Liraglutide and semaglutide, the 2 injectable medications that are FDA approved for weight. As I mentioned before, the injection training, isn't ideal to be doing virtually, but virtual demonstration and online videos can absolutely be sufficient in these cases. So improving the effectiveness of remote care, there's a lot of focus on this right now because remote care has been just so widespread since March of 2020. For video visits, it's always optimal to do a video instead of a phone appointment so that you can really develop rapport with your provider, so that you guys can see each other's faces, so that you can show things during a visit. So whenever possible to do video instead of phone, it's always preferable. It's really important to make sure that you have a good connection so that you're able to have an entire appointment with your provider without any interruption, without frustration. So treating appointments like a meeting and really making sure you have an appropriate setup and appropriate connection and that there won't be any disruptions is very, very helpful. So same point, limiting distractions, being somewhere where you can really focus on the appointment. Sometimes when you're at home, there's so much going on, or wherever you are, there's so much going on. So really important to kind of be somewhere where you can focus on your appointment so you get the most out of it. And then building in extra time. Sometimes it can take a little while to find the link to get connected, or whatever the issue may be technologically. But doing a trial run, testing it out, building in extra time to make sure that everything runs smoothly. And then optimizing technology. So exciting that we're able to collect vitals like blood pressure, heart rate, weight, through remote monitoring, through devices. So make use of these things. Really helpful to be able to collect this data virtually. Physical exam. So as I mentioned, so much research and so much innovation in this space right now that will just get better and better. And then access to your home. If there's something you want to show your provider, if you want easy access to your medications for reference, it's really exciting for us as providers to have a snapshot of patients' homes, if that's something that's appropriate, and something that the patient is comfortable with, and then they can share any number of things that could be very pertinent to their care. So personalizing medicine, strategies to optimize care. If you feel like you're someone who's a little bit less tech savvy, if you need more support, if you're prone to distraction, if you have multiple health conditions, I just wanted to go over a couple of tips for each of these categories in order to get the most out of telemedicine for your obesity care. So if you're less tech savvy, asking for technological support, doing a trial run, incorporating extra time for your visit, and asking help from a family or friends if you need it. If you feel like you need more support in terms of your medical care, if you've been having a hard time, if any number of reasons why you may need more support, more frequent visits may be easier to accomplish in a virtual way than going to more frequent in-person appointments. So an exciting opportunity to have more support from your care team by having more frequent visits, and even including other providers. Every once in a while I have a patient who would like their primary care doctor or another one of their providers to be present for our appointments. So when people are in all different places and they don't have to travel to the same spot, telemedicine really makes that so much easier. If you find that you're prone to distraction, treating the appointment like a meeting. So limiting distraction around you. The most important thing is really limiting risk. We've had several situations where our patients connected to their video visit and they've been driving. And so we have a strict policy that if a patient needs to be in a car, that's fine. Sometimes that's, the most private place in the middle of a workday, or if they're on the go, but no driving, because that is a huge liability, and not a good idea. And then finally, for people who have multiple health conditions, sometimes it is really important to see your providers in person to do a physical exam for any number of reasons. So having a combination of in-person and virtual care can be a very good model for people with multiple health conditions. And then really making use of technology between visits to have better access to vitals and data so your providers can monitor more closely. So patient journey. I love talking about the difference between weight loss and weight maintenance because they are such different phases. And for you in either of these phases, you really need different things, and technology can support you in different ways for these two periods of your journey. And so for weight loss, this is a time where it's easy to get off track, where if things are slowing down, it can be discouraging, there can be frustrations. So having a lot of support from your provider or support from your care team, support through technology to maintain your momentum can be particularly helpful. Whereas with weight management, or this should say weight maintenance, I apologize. This is a time when weight regain is common and people can regain quickly and significantly without the appropriate support. So for the weight maintenance phase, the support through technology and the support of having your providers be more available through telemedicine can be particularly helpful to avoid weight regain. So back to the weight loss phase. In that telemedicine facilitates frequent visits, this provides a more consistent support for this phase. This is a time where if you're on a medication, you may need more frequent medication adjustments or adding in another medication if everything else is optimized and you've really hit a plateau. So to make these more frequent adjustments and do checks to see if you're having side effects, tolerability, how the medication's working, can be very helpful to do these more frequent check-ins virtually. And then using technology to our advantage. We are very big on having our patients weigh regularly so we can really see the weight graph. So as in this picture, you can see exactly, when you hit a weight plateau and when it may be a good time to see your provider to intervene and talk about next steps. So using technology to our advantage to identify when intervention is a good idea is very helpful. And then for weight maintenance, since it can be more convenient to see your care team virtually, this facilitates more support and support kind of as needed if you're getting into trouble, if you're noticing, the beginning of weight regain, if you're starting to get more hungry, if you're starting to have cravings. All of these things can happen during the phase of weight maintenance. So being able to schedule appointments as needed can be very helpful. Medication troubleshooting. So if it feels like something's not working anymore, if you're starting to have side effects, any of these things can come up at any time, and being able to have access to, appointments as needed can be very, very helpful. And then again, using technology to identify weight regain. It's very frustrating for providers and very frustrating for patients, for everybody, if someone regains a significant amount of weight that they've worked so hard to lose, and we could catch it early and kind of intervene before a lot of weight is regained. So in order to really identify regain early, we can use technology to our advantage here. So let's shift gears and talk about health disparities. So telemedicine is really exciting because it has the potential to improve access, but it also, we need to recognize that in certain ways it can widen the gaps. So let's talk about that for a couple of minutes. So for people who live in rural locations, for people with difficulty with transportation, when it's hard to take time off work, if there are childcare responsibilities, and for people with certain disabilities, telemedicine can absolutely close the gap and just make care so much more accessible. However, if you don't have access to technology, if you're not comfortable with technology, if you don't have support for using technology, if you don't have privacy at work or at home, or if there are other disabilities that are making this more difficult, telemedicine can widen the gaps in some ways. So we just need to be aware of this condition. So let's take a look at some of the policies and initiatives to address obesity. So a few months ago, there was the White House Conference on Hunger, Nutrition, and Health. And it was very exciting that they talked about obesity being a disease, the importance of prevention, but the big topic that was kind of left out was obesity treatment. So the Obesity Society and many other societies came out with statements about the need for obesity treatment, the need for obesity treatment to be accessible, for it to be comprehensive, and for it to be affordable. And what's exciting about telemedicine is that it really can improve access to comprehensive and more affordable care. When we take a look at the Institute for Clinical and Economic Review, the policy recommendations that came out very recently, a few months ago, saying all stakeholders should take steps that make effective treatment options for people living with obesity available in a way that will help reduce health inequities. Telemedicine absolutely fits in here to improve the options, to increase options, to make care more available. So exciting progress that we're making in this area. So what are the unanswered questions? Right now, regulations and insurance coverage are enabling us to provide care virtually and have pretty good coverage. But will this last? This is something that we really need to fight for and make sure this lasts. Will limitations on virtual prescribing of controlled substances reduce our medication options meaningfully? So controlled substances aren't a huge part of our armamentarium, of our options for medications, but for some patients, some of these medications can be absolutely life-changing and extremely appropriate and effective. And so our limitations in prescribing controlled substances, will that have a meaningful effect? And then can providers really develop rapport, deliver education, and provide support necessary to partner with our patients against their disease? So as we collect data over the next few years, time will tell, but I'm very confident that we'll be able to do this. Maybe not for every patient. For some people, this just isn't the ideal situation, but at least for many, 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 many people who need access to quality obesity treatment, I'm confident that we're able to provide a very high level of care. So finally, take-home messages. Telemedicine can improve access to obesity treatment. It's associated with benefits, limitations, and a couple of unanswered questions. Telemedicine can address and worsen health disparities. And finally, more research is needed on how to use telemedicine strategically to improve patient care. So future requirements for virtual obesity treatment, I really want to make the point that, quality obesity care is something that we've kind of figured out in person and we're figuring out virtually. But the whole idea is to really use virtual care to mimic everything that we are able to provide in person. So all of the principles of comprehensive obesity management need to be applied to telemedicine. We don't want to have to compromise any aspect of our care. So our mission, if we're providing virtual telemedicine obesity care, is to ensure responsible, safe, effective, comprehensive, personalized, accessible, affordable, and long-term obesity treatment to enhance treatment quality and reduce barriers to entry. So the question that I will leave you with is, how can telemedicine support your care plan? Thank you so much for having me. It is a pleasure and an honor to be doing a health talk for the OAC, and I wish everybody the best. Thank you so much.
Thank you, Dr. Saunders, for providing us with such helpful information on what telemedicine is and how it has improved access to medical obesity care. The OAC has a variety of educational opportunities for you throughout the year, but one of the best places you can turn to for quality, unbiased education is our resource library. Simply visit obesityaction.org/library and check out our brochures, articles, guides, videos, and more health talks. Also, be sure you subscribe to our YouTube channel to get notified of any future educational events and broadcasts. Thanks for joining us.